All right, so now I want to talk about normal kinematics of a knee, or how the knee behaves in motion. Because a knee is not a static thing, it's not a hinge. The knee actually has 6 degrees of motion. The knee can bend, it can pivot, and it can glide. And as you watch the normal knee move throughout range of motion here, you're going to be able to see that. It's not just hinging back on itself, but you can see it slide backwards, and you can see it actually pivot. Especially as the knee comes into full extension here, you can see that last little bit of pivot. And as the knee bends, it actually slides posterior on the lateral side back there. So this is a normal knee, all right? This is not an arthritic knee. This is not a replaced knee. This is a normal behaving knee. And so if we look at this diagram right here, what you see is the medial side over here and the lateral side over here. And these bars represent the position of the femur relative to the tibia at different degrees of flexion. And so we go from extension up top to flexion back here. And what you see is throughout that range of motion, the femur rolls back on the tibia, right? It goes from more anterior, more towards the front, more towards the back. But it does so to a greater degree on the lateral aspect of the knee as opposed to the medial side. And what we call this is the medial pivot, because the knee essentially pivots off the inside of the knee and rolls back on the lateral side of the knee. So you can see it actually happening with this animation. If you look at the lateral side on the other side, watch as the knee bends, watch the femur roll back right there, right? It does it way more than the medial side of the knee. The reason for this anatomic difference, or the reason for this kinematic difference, is actually partially due to anatomy. It's due to a lot of factors, but anatomy is the first thing we want to look at here. All right, so this is a lateral of a knee. So the femur here, patella here, and your tibia down below. All right, so if we highlight the medial compartment of the knee here in orange, what you're going to see is that the medial femoral condyle, which is the part of the femur that's highlighted, comes down further than the lateral femoral condyle. All right, and the medial tibia is concave, or it creates a dip, right? So that acts like a pivot point through which the knee works. If you look at the lateral side, it's different, okay? The lateral side, the lateral femoral condyle, doesn't come down as far as the medial. And the lateral tibial plateau here is convex, or it bumps up like this. And that bump up allows the femur to roll back on it better, all right? It doesn't cup it like the medial side does. So this anatomic difference makes a huge difference in how the knee behaves in motion. All right, so let's look at this animation. We have the medial side over here and the lateral side over here. And this is a normal kinematic knee. This is how the knee is supposed to move. You'll see the medial and lateral side both move, but watch it kind of fan out. Watch the lateral side move more. Especially as you get into flexion, you really see it roll back there. And that's the difference, okay? We also need to look at where the tibia and the femur sit in relationship to each other, all right? A standard knee or a standard pre-arthritic knee, this is what you see. You see the femur shifted anteriorly relative to the tibia so that the back of the femur and the back of the tibia sit parallel, or relatively so. Whereas a standard knee replacement, what you'll see is that the femur is now shifted posterior on the tibia, and you get this posterior overhang, or overhang in the back of the knee. So this is the front, this is the back. That's a standard knee replacement. You can see that here, right? So if we look, this is a pre-arthritic normal knee. The femur is anterior relative to the tibia, and you don't have much overlap. Whereas a replaced modern knee, there is overhang posteriorly of the femur. So it's sitting in a non-anatomic position. So we'll shrink that. The next thing to consider is the patella, right? So the patella, throughout range of motion, glides in the trochlea. So as the knee bends, the patella actually moves down, and that's where it engages. It engages into the femur bone as you flex the knee. And this is really important because the patella should fit right in that groove. We call that groove the trochlear groove on the femur, and the patella should glide right in there. But if you change your femur rotation to abnormal, if you externally rotate or internally rotate it too much, your kneecap doesn't glide perfectly and you can have problems. The final thing to understand about knee kinematics is that there's a complex design of soft tissues that all help to balance the knee, okay? So up top here, we have the lateral knee anatomy. And there's the popliteus, there's the popliteal-fibular ligament, there's the LCL, there's the IT band, there's your hamstrings, there's your gastroc. There's a lot of structures that all help balance the knee on the lateral side. And everyone has a little bit different tension in all those ligaments, but they're all designed to allow the lateral side to have a little bit more movement than the medial side. So on the medial side, we have the superficial MCL, we have the deep MCL, we have the pes, we have your hamstring tendons. You know, there's other soft tissues that come in. There's the VMO, which is your medial quadricep. So it's different tissues that help balance the medial side and make it a little bit more of a pivot, make it a little bit tighter as opposed to the tissues on the lateral side. So it's a combination of all of these factors that help drive normal knee kinematics. And we're going to see where conventional knee replacement doesn't really recreate this, and how the Journey to Total Knee by Smith and Nephew does a much better job of recreating this. It's the closest thing we have to an anatomical knee replacement.